African countries are still plagued by several challenges to meet growing health demands. A lack of resources, infrastructure, quality services and rising costs means millions of people cannot access proper treatment. Delegates from across the continent recently gathered in Johannesburg to tackle these issues. Here's CGTN's Scheier.
Over 10,000 delegates attended the Africa Health Congress in Johannesburg to address the growing challenges. In many parts of the continent, there's still a struggle to provide the most basic care to millions who live in poverty.
If you look at the major preventive activities that can really make a quick difference to the population, immunization is one. And we're not just talking about immunization for emerging diseases, but even for the old diseases, measles and so on. A lot of our countries still have not reached the level of coverage that is required.
Access to medical services have improved, but health systems can't cope with Africa's rapidly growing population. It's expected to double to around 2.4 billion people by 2050.
Quality is a big challenge, and I don't think that we are there yet. The UHC, Universal Health Coverage Agenda, is about access to quality and affordable services. And if you look at those three areas, we are behind in terms of being where we should be.
Almost 70% of deaths in sub-Saharan Africa are caused through infectious diseases such as malaria and HIV/AIDS. A lack of infrastructure and proper health services, which needs to be addressed urgently, deprives many Africans from access to life-saving treatment. Non-communicable diseases caused by unhealthy lifestyles are also on the rise.
But we now have a big burden of non-communicable diseases, diabetes, hypertension, heart, renal conditions. So we now have to deal with both, which the rest of the world has never had to.
Smarter and simpler technologies are helping to ease the burden on the industry.
And we think of smartphones and apps that are now becoming affordable, that have got a marginal cost, that make a huge impact and will make a huge impact in healthcare. So there are technologies that are becoming available that in fact are cheaper and actually are portable and are scalable to scale to meet the needs of poor people and people in rural areas.
However, there's still a lot of work to be done. African governments are increasingly looking to the private sector to help fund healthcare. Scheier, CGTN, Johannesburg, South Africa.